Hi, my name's Vix and I'm working in the advice service. We're doing some work with our I Am Not Fine suicide prevention campaign, where we want to encourage students to acknowledge if they are not feeling great instead of trying to hide it, and to reach out for support, and also to know that things can change, people can feel differently. So however, if you're stuck at the moment, that doesn't need to be forever. Today I'm in a beautiful garden with Heather from Papyrus, which is a national charity dedicated to suicide prevention in young people, and we're just having a chat about some of the resources, what Papyrus is, and perhaps this will be useful for you if you're looking for support. So hi, thank you very much.
Hi, thanks for having me, Vix.
Can you explain to us a bit about what Papyrus is?
Yes.
And the services you offer?
Yeah, sure. So as you said, we are a national charity dedicated to the prevention of young suicide. And when we talk about young people at Papyrus, we mean anyone under the age of 35. And that's really to honour the founding members' parents who set us up 25 years ago, because they'd all lost children to suicide between the ages of 13 and 34. And we work in several different ways really to prevent young suicide. So we provide support through our national helpline, Hopeline UK, which I'll talk about a little bit later. We try to equip communities and organisations through providing suicide prevention training. And we influence, so we put together campaigns to try and break some of the stigma around talking about suicide, because we know that talking about suicide in a safe and sensitive way can save lives.
That's really important work. Do you have an idea of numbers, or have you seen any trends happening recently with the work that you're doing?
So I guess that information will probably come through the calls that we receive on our helpline, Hopeline. And as it's a confidential service, we don't publish data specifically from Hopeline, but we've certainly seen since the pandemic and lockdown a 28% increase in the number of contacts and callers. So we know that people are reaching out and getting support, but we also know that people are being affected and having thoughts of suicide. So we've also seen this year from January and February that we continue to see a high number of contacts through Hopeline.
Well, 28%, that's quite an impressive stat really, and quite worrying, but also good to hear that people are reaching out. And that's one of the things we see, is that people feel maybe stigma or ashamed or embarrassed, or they just get stuck and thinking, sometimes not even aware how down they're feeling. So it's great to hear that perhaps that's a good thing, that more people are reaching out for help. You mentioned the helpline. Can you explain a bit more? Hopeline, is it?
Yeah, so Hopeline UK, it's our national suicide prevention helpline, and that's open every single day from 9 a.m. till midnight, 365 days a year. And we're really fortunate now that from the end of summer onwards, we're actually going to be extending the hours of our helpline, so it will become a 24-hour service. And that's really to reflect the needs that we're seeing. And the Hopeline, it's staffed by trained suicide prevention advisors, and their emphasis is really working to explore why the thoughts of suicide might be present for a young person, and to help them focus on staying safe. So safety is a really important aspect of Hopeline. So it's open to any young person under the age of 35 who are having thoughts of suicide, but also anyone of any age who is concerned about a young person. And that's really important. So it might be a friend, parent, carer, teacher, and they can contact Hopeline and again get some support and advice as well. People can call, text or email Hopeline, and again we sort of work with that person, that caller, to look at what's going on for them at that time. So we can provide resources and information, and we also have Hope Link, which is an online digital safety planning tool. So during the call, a young person can focus on staying safe, and then they can access that safety plan at any point. And again, people might sort of call Hopeline on a one-off, so it might be that they're experiencing in the moment and want something in the moment for that person, and they want to get that support in the here and now, or it might be that they sort of need to continue to seek that support around having thoughts of suicide.
Thanks. I didn't realise the Hopeline would be so proactive. And I guess that's a question we also refer people to Samaritans, Nightline, great services.
Brilliant, yeah.
Is there so it sounds perhaps it's more proactive, more...
So, I mean, I kind of, I'm really mindful of not drawing too many comparisons because there are loads of brilliant helplines out there. I guess for Papyrus and for Hopeline, our focus and our expertise is young people and suicide prevention. So that's our real kind of area of expertise and focus. We do listen and we provide that safe and confidential, listening space for someone to talk things through. But as you said, we do focus on staying safe. And we use the PAL model, so the Pathways of Assisting Life. So we will again try and support someone to work on, staying safe and having some strategies in place. And we can also signpost them to local resources in their area as well. So we try and be guided by what the caller needs, but again, we will sort of work with them in a kind of advice and information way as well.
Thank you very much. If someone was to access your service, is it confidential? That's quite an important one for people to know. Yeah,
it is, definitely. I think that's the first thing that people want to know really is who's going to know this information and where is this information going to go. And that's one of the things that we make really clear about Hopeline. It's a confidential service, and actually when someone calls up, the advisor will talk them through our confidentiality policy right at the beginning of the call. So that's made really, really clear. And that, like you said, it's really important that someone feels it's confidential, so that it is a safe space, so they can talk about their thoughts of suicide. We do have an intervention policy, and we also sort of explain that at the start of the call. So what that means is, if during the course of the call we become aware that someone's at immediate risk or they're not able to keep themselves safe, then we will look at possibly intervening, maybe by calling emergency services, for example. But again, we will always talk with the caller to explain what we're doing and why we're doing it. And if we do have to pass that information on, we are explaining to the caller why, and it's usually limited information of just the essential information that an ambulance or paramedic might need to know.
Thank you. I think that's really important to know. If someone was worried about perhaps a friend, is there any kind of advice you would give them for supporting someone that they were worried about?
Yeah, I think that's a really good question, Vix, and I think during exam season especially, it's really important to kind of be checking in with each other and sort of reaching in as well as reaching out, because we know that exams affect everybody at some level, and they affect people differently, and so I think if you're living with housemates or friends, it's about trying to create that space to come together and have that openness, so that if things are worrying people, they feel able to share that with someone close to them. If you're worried about a friend, I think one of the main things that you can do is let them know that you're a safe person to talk to. So try to give them that kind of safe listening space to talk about what's going on for them at the moment, and kind of checking in and just exploring maybe what's going on for them at the moment.
So it's okay for people to say, are you okay? It's a part of our I'm Not Fine campaign, is the worry that people just keep that inside, and actually it's all right to say that, and even to say it, I don't think you're going to make anyone worse by saying that. Is there it's a difficult conversation to have. Any tips for people who are struggling to kind of know how to broach the subject?
Yeah, you're right. It can be a difficult conversation to have, and I think there's huge amount of stigma around opening up and talking about how we're doing, and also sort of admitting if we're not okay. I think we're so used to saying, hi, how are you? I'm fine, great, okay, and just closing that door. But actually, we need to start providing that sort of safe, supportive space where people can be honest and kind of upfront about how they're feeling with other people. And it's not necessarily down to that other person to take responsibility for that person, but it's about, again, supporting them to access other services and resources as well. So I think it can sometimes be helpful to be aware of what other support is out there, both within the university but also wider community. So if you are worried about someone, you can, maybe accompany them or support them to access either university wellbeing support or a helpline. I know the Guild has loads of advice and information as well around welfare and wellbeing as well. So it's not necessarily about having all the answers, but it's about maybe knowing where to go to support that person to access other services. I think the other thing as well, it's about, like I said, sort of letting that person know that you are a safe person, you know, that you might not necessarily have all the answers, but that you can provide that non-judgmental and supportive space for them. I think that's really, really important as well.
Yeah, lovely. And if someone says they're not feeling okay, we kind of want to encourage people not to panic when they hear that, and just listen people out, and then obviously look at the services, and that can be a great tool as well if you're thinking, oh, I found this website, it seems really helpful. You mentioned earlier about exams. It is a big stress point, and I think you said you had a resource that was quite useful.
Yeah, so we put together a great resource around coping with exams, and that's available on our website, and that gives some really good tips about managing time, you know, pacing yourself, but also giving yourself some space as well. And we have recently, one of our amazing volunteers has put together a podcast, and again, they've shared some hints and tips around managing exam stress. I think one of the main things is that, you know, everyone copes with exams in different ways, so there's not necessarily a set way of feeling or doing it. But actually what's really important is self-care. So, you know, giving yourself that time to do something maybe unrelated, that you know that will make you feel better. And again, self-care can look like lots of different things for lots of different people. It doesn't have to be grand gestures. It might be going for a walk or meeting a friend for a cuppa. And I think it's also really important to connect with people as well. I think sometimes people can get so focused on cramming and revising, but actually taking that time to engage with your support networks, your friends or your family, and kind of again having those spaces to sort of talk about how you're feeling and what's going on can be really important as well.
Yeah, it's one of the things we see is that students come to university for an education, but there's also so much more. There's so many societies, volunteering opportunities. It's really about feeling connected and feeling part of something. And there's loads of activities you can give it a go and just try things, but they're really helpful tips.
Yeah. And what I would say is, you know, if you are concerned about someone, if you're worried about their well-being in general, or worried that they might be having thoughts of suicide, I'd really encourage you to make yourself aware of what support is out there. Get advice if you feel a bit worried about having that conversation. So, as I said, you know, anyone can contact Hopeline. So if you're worried about a friend, you can contact Hopeline and get some advice and support around having that conversation. And on our website, we've got some brilliant information about conversation starters as well. So that they're kind of tips about how to navigate and start that conversation with somebody. But I think one of the main messages is you're not alone. I think that's really important. You know, I think when you're doing your exams, it can be quite easy to sort of lose that sense of perspective because we get so absorbed in the kind of the impact of the exams. But actually, I think it can be helpful to sort of remind ourselves that whilst they are obviously important, it's not necessarily the be all and end all. So again, it's getting that advice and support to explore, you know, what your well-being needs might be during the exam period, and how you yourself can kind of check in and recognise when maybe you need some more support and maybe you're not feeling okay.
Absolutely. And at the end of the day, things, if they don't go so well, it's not the end of the world. It's lots of things can be done, and your university experience is just much more than just a piece of paper with some exam results on. You're so much more important. Well, thank you very much, Heather. I really hope that this has been useful for people who have maybe heard of Papyrus and didn't quite understand what they were doing, or have just never even heard of them. This is a great resource. All the information about Hopeline, the resources are all on the website, so we definitely recommend that you check those out. Thank you.
Thanks for having me, Vix. Thank you.